and then we find ourselves taking our child to the hospital. What I want to take us through in the next couple of minutes is some of the other areas where we can take our children to. Okay, the most important thing to remember is if you haven't got a GP and if you're not registered with a GP, it is vitally important that you do register yourself with your GP. What your GP can then do once you register is take a long history of all of the concerns that you have with your child and their health. So, if there are any concerns about your child not breathing properly or having lots of coughs and colds, having problems with their feeding, or having any skin related issues that you're particularly concerned about, then and also the other main common presentation we have is sleep related issues, then you know that the GP will be able to support you with that. So it's vitally important if you don't have a GP, please register with your GP. And how do you register with your GP? The website is there. You can get more information on there. But more importantly, you can pop into your practice that's nearer to your home and ask to become a patient. All of our practices are open to new patients, so you can then register with the practice. What we've most recently started is we are now able to offer GP appointments in the evenings and in the weekends. And as I was saying before, that most of our children, we seem to be able to cope during the day, but it's in the evening that we need support from a specialist just to tell us that there is nothing major going on, or if there is something major going on, telling us what to take to help our children. So what we've got is your extended access hours, which is basically GPs who will be available in the evenings and at the weekends. And this is after 5 o'clock, so from 5 p.m. to 8 p.m. And in the weekend hours, it's from 9 till 11 in the morning. So it is very important that you be aware of it. So it will not be your own GP. So don't call the number. We will tell you through where to call in a minute. But please use your GP extended hour service. Now, this will not be your own GP, so it's very important to be mindful of that. It's also important to remember that your child needs flu vaccination. And if they have got a particularly history of asthma or history of other conditions that affects their chest, it's very important to check your GP whether they're eligible for flu vaccination. Flu vaccination is done through the child's school if they're going to school. If they're not going to school and preschool stage, then flu vaccination is available through their GP. It's very, very important because we think flu is not that serious, but in children it can be very serious and it can cause quite serious complications like bronchitis and pneumonia. The flu vaccination for children is through the nose, so nothing to worry about children getting scared about injections. Again, to reiterate, most of the school children should get it from their school. If they're not school age going, then your GP should give it to you. If by any chance any of your children haven't received their flu vaccination and they go to school, please can you contact the school again and get the flu vaccination. It's vitally important that we get this flu vaccination into our children. So the, the flu vaccination will also not only protect your child, but will also protect other family members and friends, and the children aged 2 or 3, and including if you're also expectant mother, if you're expecting a child soon and you're pregnant, then please also get your flu jab, because it'll protect your unborn child as well as you from serious complications. Now, our pharmacists have got a wealth of information and support that they can provide for our children, particularly now while we're in the winter season. You can see your local pharmacist and make sure you've got the medication that is normally used. So the one that comes to mind is Calpol, which our children could do with once if they've got if they've got fever that needs sorting. It's important that you speak to your pharmacist and see what are the medication that you could stock up for in the winter season. So many over-the-counter medicines like paracetamol, ibuprofen are available to relieve the common winter ailments such as cold, sore throat, cough, sinusitis, and painful middle ear infection. However, please do not keep giving the medication if you feel that the child is not getting better. So it's very important to use the medication to see if symptoms are getting better. If the earache or the fever or the cough and cold has not got better in a day or two, please talk to your GP. Okay. Some of our children may have been diagnosed with asthma. Very few, maybe children who've got other conditions such as diabetes. If that is the case, please make sure that the medication that they have, say inhalers that has been prescribed for them, are in date and you've got enough quantities so that you do not run out on a Friday night or over the weekend, because it is important that if a prescription medication has been prescribed for your child for their condition, they need to have it all the time. Make sure you've got the space inhalers to give the medication for asthma, because and they're checked and maintained regularly. Again, if you want to get your repeat prescriptions and you can get them online, please use the website that's on this slide. Again, your pharmacists are a very good advisory people. They have a wealth of knowledge around this. Please see them. Now, so first signs of illness. If your child starts to feel unwell this winter, even if it's just a cough or cold, you can go to your pharmacist before it gets more serious. They'll be able to help you to get that initial Calpol, initial cough medicine, and they will also be able to tell you whether you need to see somebody at the hospital or extended GP or GP straight then, or if it's a mild symptom that can be resolved with medication. So you could talk to your pharmacist for any signs and symptoms that have come on. But however, if you think they're serious, then you need to see a GP. So pharmacists are only medicine experts. They can also offer advice and information, and they can also offer a lot of advice and information on those cuts and bruises and falls that our children go through when they're in school. So the website tells you where your nearest pharmacies are. Most of our Tesco's and our superstores have got pharmacies in there. If you're passing through for some shopping and want to get some advice, do please talk to them and get advice. It's much quicker to see your pharmacist than waiting for your GP to give you an appointment. So this is a lot of some of the leaflets that are available online. If you Google any of this, these will come up. We're Googling things all the time, but all these information is available online for you to download, and you can then have additional information alongside this webinar that we're doing for you. NHS 111. If you're concerned about your child's health and you need urgent care, and this is what I was talking about, when you feel that the pharmacy resort or you giving Calpol is not the right thing, your child definitely is unwell and needs to see somebody. And as a mum, carer of a child, you're the best judge of that. Call NHS 111. NHS 111 is open 24 hours a day, every day of the year, and it's free to call from your landline or mobile phone. So NHS 111. Please do not forget this number. Please use it to call for any concerns that you have with your child, and there will be somebody to assist you 24 hours a day, every day of the year, and it's free to call the number. Please save it as your saved number or most frequently dial number on your phones. Use it and somebody will be able to advise you straight away. Using the 111, it'll help you to get the right care, and it'll save you time and effort and unnecessary journeys. So you might think, okay, well, I'll try and take my child to casualty and wait there. It may not be necessary. If you call NHS 111, what they may be able to do is, after talking to you, help you to get care in a much quicker, in a much more child-friendly place in a neighboring GP surgery. So please use 111 and before you try and take your child to the hospital, because you will have fully trained advisors who will support with your range of provisions that you can go to, where you could see a doctor or a nurse, and you could see them sooner than if you actually went to the hospital. We've also got walk-in centres. So there's NHS walk-in centres who also offer fast and convenient access to health care. They also provide first aid. So I was talking about the bruises and the cuts and grazes that our children come back home from, or you get the call from school to say they've had a big fall. And you can walk in 7 days a week, and you can get advice and support and treatment in your walk-in centres. They're run by professional nurses, and the professional nurses will be at hand to offer the help you need. So the NHS walk-in centres, So the nearest, the one that is in Bedford is from in Putney, and it's the Putney Medical Centre, and it's open from Monday and over through to weekend, and it's usually open from 8 a.m. to 6 p.m. most days, and they will be able to help with all necessary advice and support and treatment for your children presenting with any symptoms. Okay, now there will be very rare but there may be situations where you feel your child needs immediate support. They're bleeding severely, they've got breathlessness that you you feel they're not breathing properly, they've got severe chest pain, or they're fitting, or if there's something that's really, or they're getting blue, or they're listless, as in they're not being themselves, immediately call 999. 999 will send a paramedic with an ambulance to you, and they will be able to support you at your home as soon as you call them, or as soon as they you can get to you, they can get to you, or take your child to the nearest A&E. And this is very important for those conditions where you think your child needs immediate attention. So that brings us to the end of the call that we've got today, to just give you a breath of information about how there are areas other than the hospital who can support you and your child when you need some attention and care. Now, I've got 4 people who've joined in on the call, and I have sort of made it sure that you can now talk to me if you've got any questions. If you've got microphones on, could you put them on from your end now? And if there's any specific questions you want to ask me, I'd be very, very glad to answer them for you. I have with me Jackie Syme, who's a very senior health visitor who works across Bedfordshire, who will be able to support with any specific queries that you have. Few things. When you ask a question, please tell me who you are and which GP practice is closest to you. Please, this is a public forum, so this is being transmitted across a wide set of areas. Please be careful you don't share any confidential information that we wouldn't be able to then safeguard. And also, please tell me anything else we can help with, but please also respect any views that's shared within this forum. I will stop now and take any questions anybody has. Hello? Is there a question? Which questions were there? These ones. Are these the questions submitted? They've been submitted already. Okay. So these are some of the questions that we were asked to talk to. These questions were submitted in advance, so I will go through them. If people don't have any questions they think they can ask. So the first question is, do you recommend cough medicines for children with a persistent cough? The answer to that question is no. If your child has got a persistent cough that is not getting better, you need to seek advice from your GP immediately. You need to get advice before giving them any more cough medicines. So the answer to that question is no, and go and see a GP. Or if the child is under the age of 5, you can speak to your health visitor. Second question. Hello? Has somebody got a question? Hello? Okay. Second question that was put to us is, how do you bring a poorly child's temperature down? The question is, how do you bring a poorly child's temperature down? The answer to that question is, if your child is playful and if your child is well enough, if they're eating and drinking well, but they're running a high temperature, please give them Calpol and see if that helps. If your child is not in themselves, if they're feeling tired, not wanting to eat and drink, and not playful, then you need to check their temperature, and if it's high, get advice from your GP or 111. Okay? So you as a mother, as you as a mother or carer of your child would be able to judge whether your child are in themselves or are feeling so poorly that they need to see somebody immediately. So that is question 2. Question 3, do I need to keep a sick child away from the siblings or elderly relatives? Now, this is a tricky one because if your child, if your the siblings or elderly grandparents are well and they want to play with your child or look after your child when they're not well, and that is fine, provided they are in themselves fit and well enough to be looking after your child or playing with your child, particularly if they're not well. However, if there is a condition where your elderly relative has got a, a condition in themselves or are suffering for something in themselves which has caused them to be more prone to getting infections, so if they've got cancers or if they're on medication that has caused them to have more susceptible to get more infection, then it's important that you take advice and keep your children who've got an infection away from them. Other than that, there shouldn't be any reason to keep your sick child away. So that's question 3. The question 4 is, my child has missed the flu vaccination at school. Can I go anywhere else to get it done? The answer to that question is the vaccination service should go back to the school and vaccinate the children that haven't had the vaccine. If that hasn't happened in this school where your child attends, I would speak to your school and get advice where to take your child and call the number that is for the vaccination service. So the answer to that question is very clear. Please contact your school, who will be able to tell you where to take your child to get your child vaccinated. Again, to reiterate, it is extremely important that your child does get the flu vaccination this winter because it will protect them from a lot of infections and a lot of flu sort of chest-related infections and conditions. 5th question, how long will I have to wait to speak to someone if I call NHS 111? NHS 111, as we said, is manned 24 hours a day, 7 days a week by very trained advisors. So you should be able to speak somebody straight away once you've navigated through the initial bit of the 111 call, which tells you to check for options. There should not be a delay for anybody who calls 111. But if you are experiencing any problems, we've got our contact details, and please do let us know. We will look into it. There should not be any delays in you speaking to somebody. 111. So the question number 6 is, if I contact NHS 111 and they decide to make an appointment to see a GP, will I see a GP from my own surgery? Now, this is what we were discussing, that if the NHS 111 says you need to go to a GP and the GP is out of hours, which is after your normal GP surgery has shut, then you will get to see a GP. He may not be from your GP surgery, but he will be listening to you and taking all of the information that you have and would be able to give you the appropriate advice and care for you and your child, and will also be able to give you prescription and other things that you and your child require. So the answer to the question is no, you will not see your own GP. It will be another GP from a different surgery, but they will be able to still support you and your child with any advice, care, and prescription that you require. Any other questions? Hello? Is there any other questions? So we are going to stop this webinar now, and we will publish all this information on our website, on the YouTube, on the Facebook page, and are we going to tweet as well? We will tweet as well. If there is any feedback you want to give us, please, please, please use those forums to let us know what else we can help with. We will keep rerunning some of these sessions again in the future, but please help us to shape them for you so that we can get the right information for you. Thank you very much for your time today, and hopefully the children and moms out there can stay safe and stay healthy for the rest of the winter. Thank you.